How does central sensitization cause CFS muscle pain? Imagine your nervous system as a finely tuned alarm system. In some cases, this alarm system becomes overly sensitive, constantly ringing even when there's no real danger. That's what happens in central sensitization, a process where the brain and spinal cord become hyperactive and start amplifying pain signals. This means that even tiny stimuli or no stimuli at all can be perceived as painful. The nerves become more excitable, and the pathways that carry pain signals get stronger, while the systems that normally dampen or inhibit pain become less effective. As a result, pain feels more intense and widespread. In people with chronic fatigue syndrome, this heightened sensitivity often shows up as widespread muscle pain. Although scientists are still studying the exact link, many patients with CFS experience hyperalgesia, which is an increased sensitivity to pain, and allodynia, where normally painless stimuli like light touch or pressure cause pain. Interestingly, their pain can worsen after physical activity, heat exposure, or stress, which is different from how healthy people respond. This suggests that their central nervous system is processing pain signals abnormally, making pain feel more intense and persistent. The process begins with peripheral triggers, such as infections or immune system issues, which are common in CFS. These triggers releases inflammatory substances like interleukin-1b that sensitize peripheral nerves. When these nerves send signals to the spinal cord and brain, they activate cells that boost pain transmission. Over time, this leads to long-lasting changes in how pain is processed in the central nervous system. Neurons in the spinal cord become more excitable, and brain regions involved in pain perception may change their structure and function. These alterations cause the nervous system to continue amplifying pain signals even when there is no ongoing tissue damage or inflammation. This means that muscle pain in CFS isn't just about muscle injury or inflammation. Instead, it's largely driven by changes in how the brain and spinal cord regulate pain. That's why many patients experience persistent muscle pain that doesn't match any visible tissue damage and can fluctuate in intensity. Factors like stress or physical activity can make the pain worse, highlighting the role of central nervous system dysfunction. Understanding central sensitization helps explain why traditional pain treatments that target muscles or joints might not always be effective for CFS. Since the problem lies in how the nervous system processes pain, approaches that focus on calming or retraining the nervous system may be more helpful. It also emphasizes the importance of personalized care because each person's experience with pain can be different. Recognizing this mechanism sheds light on the complex relationship between the nervous system, immune responses, and symptoms like muscle pain in chronic fatigue syndrome. In summary, central sensitization causes muscle pain in CFS by making the nervous system overly responsive, amplifying pain signals, and maintaining a state of heightened pain perception. This process explains why muscle pain can be widespread, persistent, and often out of proportion to any actual tissue injury. It underscores the need for treatment strategies that address the brain and spinal cord's role in pain regulation. Always consult healthcare professionals for personalized advice, as understanding and managing this condition requires a nuanced and comprehensive approach.